Good afternoon, ladies and gentlemen. Welcome once again to our weekly webinar on a Wednesday. We're joined once again by our SCA directors. We're joined by Matt Press, but we've got two very special guests today who are going to step us through the police response and particularly some of the experiences that they've had. So I'll just wait for you all to come into the room before we kick off, but we're very excited to present you with this week's webinar. So we'll just wait till all of you come into the meeting and then we'll kick off this week's webinar. Excellent, guys. I can see that most of you have actually logged in and we've seen some very familiar faces. And yes, to Patricia, we're also looking forward to this. I think we're really indebted to the fact that we've got two members of the police force who have been dealing with hotspot lockdowns, but also the very, very nuanced experiences of Strata in that. So I'm going to kick it off because I know there's a lot of you here and we've got questions. I'd remind you all in the background, please put your Q&As through the Q&A channel. Any that come in the chat, we'll pick up and bring them in. As always, our directors on here will pick up those questions and throw them in the Q&A. But we're very lucky to have with us today Chris King and Steve Valetas from the Emergency Operations Centre out of Blacktown, who are basically at ground zero dealing with some of these strata plans in lockdown. So gents, Chris and Steve, thank you very much for the time. As we explained just prior to coming on here, our audience are strata managers who are incredibly interested in what they can do to support yourselves. We had the health officials on last week and we got great value and benefit and hopefully great support and assistance on the ground off the back of that. And so anyone put your questions in, please, in the chat, but I might throw to you either Chris or Steve to explain what your command does and how it operates in the context of a pandemic.
If Chris doesn't mind, I'll start off. Chris, yeah, well, the first thing that I'll discuss is that people have to disassociate the police from our operational role. Like, we are an emergency operations centre, so whilst we wear a police uniform, we're not necessarily, we don't necessarily have a police function anymore. We oversee the police and the combat agency, which in this case is New South Wales Health. And we support the combat agency, Health, and activate other agencies and functional areas to support health wherever they may need, above and beyond their capabilities. So we then report up to a regional level. So we're at a local level, we report to region, who then report to the state. So we're certainly at ground zero in terms of our level. But again, we are not necessarily police. We support the combat agency and provide them facilities that they haven't got or other resources and gaps. So we will interact with council and other businesses and just provide or try to resource health as best as we can.
Yeah, so you're put in place, obviously, with these types of issues and events, and obviously a pandemic and what's occurring with COVID-19 is that very thing. So you coordinate that full multidisciplinary response, including the police, which might be required to deal with issues, of an enforcement nature and the like.
Exactly right. Yeah, for most part, police are there for that enforcement process or security, for want of a better description, particularly when we're talking locking down a building. And essentially every key agency has their own primary function. We just try to get everybody on the same page, particularly when we're talking about a big operation or a large operation such as locking down a building.
Yeah, no, absolutely. And we'll get to some of those scenarios because some of our manager members have had that very experience and have probably dealt with your office, but they've certainly been dealing with health and the other bits. So how and when does your team get involved? I mean, I guess what's the trigger for your involvement at a broader level? Clearly the pandemic was the trigger, but then how do you get dragged into either a regional area, you're in Blacktown, so or a building related issue? I guess what's the trigger for you?
So New South Wales Health govern when we are enacted, I guess. They will no doubt keep an eye on a premise and just see how the infections may be going, do their own risk management. And once they determine that the transmission of the virus is unable to be mitigated without locking the location down, they will contact us. So we will then enable a plan. In the case of some of the locations that we have been involved in, the actual building managers have been great support to us and been very much on the forefront in terms of planning. Otherwise, we rely on health to let us know when we need to become involved and bring in other agencies.
And when you say you get involved there, Steve, do you have do you get mobilised on site? And for example, in a lockdown scenario, if we can go into a specific now case study, let's go through the process of what's a likely trigger now in a building that would instigate your command coming in there and starting to take control.
Well, it may not necessarily be 1 or 2 infections. We have to be reasonable. A lot of places at the moment would probably have 1 or 2 infections in there. I'm not necessarily privy to the what the trigger is for health. I assume it has to do with what they perceive as a risk and how that virus is going to transmit amongst the building. We don't necessarily give them, like I said, they're the experts in that field, so we don't give them any advice where that's concerned. We simply step in and aid them as much as we can.
Yeah, and that's interesting because what we heard from health last week, Steve, reinforces that, and that is a single isolated case in an apartment building is something to be watchful of, but not necessarily necessitate a lockdown. Yeah. And we demystified that and took some of the hysteria out of it. And I think our members got great comfort knowing that health and yourselves, which is the overarching command, will escalate it as necessary if you have a cluster in a building or determine that something needs to be done. So
sorry, Chris, and that's correct. Like, you can't put a number of how many people in a building determine whether we lock a building down or not. And as you guys can appreciate, some buildings may only have 10 apartments, others may have 150. Yeah. So 3 apartments in a block of 100, it doesn't necessarily pose as great a risk if people are compliant. And that's a factor, obviously. We have to gauge how people will react to certain orders being placed upon them as well. Yeah. But yeah, generally speaking, numbers don't necessarily dictate whether a place will get locked down.
Yeah. So let's see if we can go through an example, because I think that's a great way to sort of flesh it out. You don't have to give us details, please, of the building, but a scenario where you have stepped into the building and determined that it does require an escalated response. Do you want to talk us through that? And then maybe some questions, because I can see some questions coming through the Q&A, which we'll monitor. But let's go through a worked scenario so that we can kind of go through how and when you'd like strata managers or building managers involved, what sort of communication. So let's go to the start of when you would or have been involved, particularly with a multi-unit residential dwelling.
Well, the start is that we identify from health holdings, I guess, how many people in a dwelling are infected. They would obviously do some sort of assessment of those people. In the cases that we've been involved, a lot of the times the source of that infection was not necessarily known, and that always poses a greater risk. So where we know where the source is, we can generally contact trace and isolate the spread. As soon as you don't know where the source is from, you simply have to err on the side of caution. So in the case of one particular unit block that we were involved in, health dictated a lot of the principles that were involved in locking the building down. In all honesty, we could achieve our objectives from an office, to be fair, because we are the conduit. We contact all the other agencies in support of health. And again, I go back to, we would contact the local area command, the police at the local area command, and establish a perimeter on that building. So the difficult thing is police have very few powers to force people to be tested and certainly to be vaccinated. We have no power, in fact, where that's concerned. So we rely on the health, in some cases, putting a stop and stay order on a building where people are restricted and cannot leave the building. And once that's in place, it enables essentially for that organisation in the police to be able to provide security. Health then, and this is really crucial, and in terms of your involvement and your colleagues' involvement, they will then need to consolidate a list of the occupancy of the occupants in a building. And that really is very crucial to how the operation pans out. When a lot of the servicing will be done remotely, so we rely on those lists to be correct as far as possible.
You've raised three really interesting points there, and I want to sort of talk to them individually, if you don't mind. You mentioned the stop and stay order, which we had explained to us by Health, which was very, I guess it made a lot of sense, was quite pragmatic. And from what we understand, it's been applied in limited circumstances where they deem it to be sufficiently high risk. So are there obviously those very serious cases where stop and stay is in place, and then you can effectively do a hard lockdown, if I can use that that term. Are there cases where you're involved where it's I call it a softer lockdown, where it's not necessarily a stop and stay, but more so just a mitigation type plan where you're still coordinating those other elements, the health and LAC and the like?
100% there have been, and more often the case where those situations occur are where there's less number of units, or in fact, and I don't know if this relates to you, but townhousing type complexes where there's a bit more space between people, and we don't have as many common areas.
Yeah,
because that's key. Once you have, if you have one lift servicing, 20 apartments, then sadly, given this strain, the people that have been in that lift are potentially infected.
Yeah, it makes sense.
Exactly right.
And that townhouse scenario that you explained, I mean, a lot of our members would understand that, particularly in the affected LGAs, there's a lot of smaller strata title schemes, which might have very limited common facilities. So the ability to manage them without a more heavier lockdown is, I guess, easier.
Exactly right. And we've had situations where you wouldn't even consider a lockdown or a stop and stay. It's just a matter of contact tracing.
Yep.
So you would have one or two locations tested. You'd ask them to obviously isolate as dictated by health, depending on whether they're considered close contact, casual contact, or in fact are COVID plus. I hope you know what that means. So obviously,
no, I think
COVID plus means that you have COVID.
Okay, thank you.
That's the term. So we sort of categorise them in three. There's COVID plus, your close contact, which means you're pretty much been near or next to someone who's COVID plus, and then your casual contact, which is just your third rung down, where you might have been in the vicinity of someone, like been to the shops where someone's been infected.
Thank you. Even it's come through on the Q&A chat, people telling us what COVID plus means, but it was news to me, and I think from the looks on some of my fellow directors, blank faces, news to them as well, Steve.
No, it's all good. It's a learning experience for all of us.
It is.
So we learn from day to day as well.
Excellent. Now, a second thing you mentioned there was a perimeter being set up. So I assume in that instance, you actually have the local area command provide a physical perimeter around the building?
We do, and that poses a massive issue and impost on our resort. I'm trying to disassociate myself from police at the moment. I'd call them out, but in terms of police resourcing, that can prove to be very problematic. In some of the cases, we've had to use our user pay system, which is essentially ask for police who want to be paid during their rest days to come and do the work. Obviously, this pandemic is having an impact on all of our agencies. So we generally speaking, it'd take anywhere between at least 10 police to, who knows, depending on the footprint of the building.
Wow. Yeah, I mean, I guess we don't really have an appreciation of what goes in, because our strata managers in some cases are offsite, but certainly that amount of people that are required and the risk exposure that gets compounded then, because you get one person taken out and that could take out a significant number of your workforce, and others there. And the last thing before I move off this point, Steve, was the occupancy list. So we received a letter from the Chief Health Officer about 2 weeks ago, really prompting strata managers to get on the front foot with ensuring that our contact details are up to date. And we've diligently done that across our New South Wales network. And I think hopefully successfully got more timely updates to contact details. But the importance of having that information from a contact tracing perspective is clearly something that really assists you. And we've been advocating for compulsory QR codes in strata plans.
Oh, yeah. Very good. Chris, if I had a wish list, that would be my two things. In terms of locking down a premise, we obviously, the manifest, or whatever you'd like to term it, the occupancy list is very crucial. It just gets our operation up and running a lot quicker. And time is key in these situations. We've had lockdowns where, and just to give your audience an appreciation, we may have 1 or 2 people infected on what we perceive as day one. And I'll just say the 1st of September might be that day. But if we don't have an opportunity to speak to other people in that building for 24 or 48 hours and then test those people, that 14 days of isolation commences when the last person has been identified. So that may extend that initial 14 days for the people that have infected on the 1st of September to who knows what. So that list is very crucial to the success of the operation. And it really, like, because one of the key factors that we have to consider is the mental health of all the individuals that are isolating. So if you're isolating for not just 14 days, but any days in addition to that, that increases the risk to those people. Like, I couldn't imagine being in a position where you're in a unit block for 14 days. It must be very, very difficult. And we appreciate so far that we've been very fortunate with the people that we've been involved with, at least just complying. Nothing stopping them from posing many, many issues to us.
Yeah, and I think, I'm glad that you said that they were the two things on your wish list, the QR code and the communication, because in a way, that's one of the biggest areas that strata managers can actually support your command's efforts and also health's efforts here, because we can't wave magic wands around behaviour a lot of the time, but we can make sure administratively we're well prepared.
And where the QR coding comes in play, it's not for obviously the people that are occupants. It's simply for visitors and people delivering food or whatever it may be, parcels, just to let us know in the case that we have to inform people that they've been in the vicinity of a place that is locked down, then we can do the contact tracing without any delay. See, there are some locations that we've been to where, and well, essentially none of the places we've been to have had QR coding, and you don't know who has been in that building over the period of time that infection has been there.
Yeah, well, and to your point, we've written to the Minister, requesting and to Health, asking for mandatory QR codes for any strata plan with enclosed common property. So those townhouses you mentioned wouldn't be captured. It's not necessarily there, but anything with a lift foyer or a gym or somewhere where people are congregating and coming through the same spot, it makes sense. So we're hopeful that common sense will prevail, but a lot of our members are now starting to do it voluntarily. And it may be a bit late in the piece, but I guess, as you said earlier, we're all learning here and trying to get better at dealing with this.
Yeah, never too late, mate.
Yeah. So how about some of the challenges around those lockdowns? I mean, not that we want to highlight those issues as being the norm, but are there things that you've identified that we need to get in front of, or that can cause, significant concern for you once you're in there trying to manage these situations?
Well, once we have locked a premise down and we've got contact with all the people that are inside, commenced our tracing outside, it really isn't that difficult a process. With the luxury of having people's contact numbers, we can arrange delivery of certain things, ensure their welfare. It really, I assume the only time that it's going to get problematic is when we have those larger buildings, and it hasn't happened to me yet, so I can't talk from experience in terms of any building that's had more than, say, 30 occupants in it or 30 units in it. But that would obviously pose an issue. And generally speaking, health did a marvellous job in the scenarios that I was involved in coordinating the provision of food and aid, and also the removal of waste. Like, everything is treated as clinical waste. And that happened, I think, a Blacktown one was it every day?
It was for clinical waste. Yeah.
So we treated all waste clinical, and it was removed every day. So again, and I guess the rationale behind that is you don't want any waste hanging around for longer than any necessary time.
So can we talk about waste? I mean, it's not a sexy subject, but it's something that's very important to our members, because a number of our members are those critical cleaners who are out there on site dealing with that waste. But our strata managers as well are often called to coordinate and advise owners around how they need to waste manage. So talk us through, you mentioned clinical waste. How is that conveyed to the building? What is your expectation of the cleaners, and what's the best practice for dealing with clinical waste?
Chris, once the place is locked down, health will organise all of that. So your strata managers really just need to support health in regards to that. Generally speaking, the model that we've had is a private company, as opposed to the local council, which normally removes the waste, was contracted. They would set up a number of bins outside the block, and each day people would leave their rubbish outside their door, and it would be collected by health staff who were fully PPE'd up, and they would get rid of or dispose of the waste. Likewise, deliveries of food and aid would be brought to the front of the building, and arrangements would be made for the staff to drop food or aid to the front door, knock on the door, and then someone would collect it. So contact is at a minimum.
When you say someone collects it, there's a whole discussion around deliveries, because obviously in lockdown, all your essentials are coming via deliveries, I imagine. Do you mean someone from health in PPE equipment delivering that amongst the building?
Exactly right. And the only consideration that your managers should have is, when we were talking about deliveries, we needed to do that in a specified time frame. You couldn't expect health to be going up there every hour, or if you understand, we've got these poor people there. They'd end up with thighs the size of tree trunks if they had to travel up even lifts, I guess. But what we did is we coordinated certain times of the day for certain deliveries, if that makes sense.
Yeah, so there's a designated health person on site who coordinates the delivery. So simplistically, Uber Eats or a food delivery or something else comes to a central point. Health take it from there and distribute it within the building. So if you're a resident, you're effectively locked in, as simply as we can put it.
Yeah, exactly. And health would just ask for people to ensure that their meals came in between 6 and 8, or whatever the reasonable time.
Reasonable.
Yeah, exactly right. We didn't want them coming in at 11 o'clock at night, or at those times, but outside of probably normal eating times, I guess.
Yeah, so just don't get the munchies if you've got COVID, I guess. Okay, so we talked about cleaners. So one point, and it'd be remiss of me not to make the point while I've got you both here, is we've been struggling with having cleaners and building managers recognised as authorised workers to enable them to exit the LGAs of concern. And it's caused a lot of angst, because, as you could appreciate, most of the buildings in Sydney that are serviced outside of those LGAs have their workforce locked in. So we're now starting to see compounding issues where buildings are under-maintained, and some of the health issues around cleaners and building managers being able to leave those LGAs to service those other buildings is built up. So if you have any influence at all, I'm sure our members would love that context to be provided, that the essential workers, being the cleaners and building managers, being able to leave is critical, particularly as now we start to loosen some of the restrictions, as the vaccination rate continues. But we've been in ongoing dialogue with health and government there, and we accept the reasons why, but it doesn't mean that we'll stop asking the question.
Can I ask what their rationale is? Because it would only appear like I certainly have an opinion. It may not be in line with what health or the government believe. Like I would have thought that cleaners would have, you know, for want of a better expression, free rein to do their job.
Yeah, it's excellent. So Matt's here, and I don't want to put Matt always becomes the mouthpiece of the government, even though he just communicates this. Matt, you've had some conversations internally. Do you want to explain the position?
Yeah, look, it was really just trying to, they really wanted to have the absolute bare minimum set, and sort of for cleaning say, look, sorry, the building's got to try and look after itself because we really just don't want the spread, knowing Delta, and they'd prefer to sort of adopt a precautionary principle and go a bit harder than might be, absolutely necessary to really make sure that we put a dent in transmission.
Mhm.
So, and yet all of us who work in Strata, live in Strata, understand Strata, know that, it is different to living in a single house. You need the building, you need a lot of supporting services to make it work. So just got a bit of a raw deal here, really.
Yeah, it does sound that way.
Look, and Steve, from the outset, we've been very clear to our members who are multidisciplinary, like they're cleaners, they're repair people, they're electricians, they're builders, they're landscapers, and we've communicated a common sense approach to limiting movement across Sydney as being the main reason why the lockdowns are in place and limitations are in place. So whilst we've accepted some of those definitions and interpretations, we clearly pushed to make sure that where logical, people like cleaners and building managers could get out. Because to your point, I think having a building manager on site, and do you want to talk about the way you've worked with building managers, particularly in some larger buildings, Steve and Chris, about how that's helped you and how you've worked in with them?
Look, I can only express my gratitude to the company that I was involved in. I don't know if I can mention their name, but Evolve Housing.
Yep. So they're the housing.
They were very proactive. In terms of the location that we had at Blacktown, they were marvellous people. In fact, the business plan that they put forward with regards to the lockdown, I would almost consider best practice. They were very much proactive in keeping in touch with all the residents to the point where in collaboration with New South Wales Health, and I guess this goes to the size of the building, it wasn't necessarily the largest of buildings, but they would have a McDonald's night and supply everybody McDonald's and, just change it up a little bit. As I said, one of the key aspects of a lockdown is that mental health issue. So anything that would assist people from getting their minds off the situation that they're in was appreciated, very much appreciated. In fact, and I don't think there's an issue in saying it, the Devon Street lockdown at Blacktown received very little publicity after it was actually locked down because of the way it was run. It presented no story to the media, and that's who Evolve were managing at the time.
Yeah. And that's the human side, Steve, that we often don't hear about, but hopefully the experience you've had can be a learned experience for our members who are listening, because we've got building managers who probably have buildings that are in similar circumstances, and hearing your feedback on how the humanity was managed so well to make a pretty hard situation bearable gives us comfort that there are things we can do to make a pretty bad situation, I guess, a little bit better for those people who are impacted by it.
Exactly right.
Yeah. I mean, we'd love, you just mentioned a best practice document there. If you could get permission from Evolve or anyone to share that with us so that we could, get some learnings from that, we would certainly appreciate that, because one thing we like to do is put information out there to as many people as possible so we can get ahead of this to deal with the next time a bit better and take those experiences forward.
I'll happily reach out to them and given the attitude that they've had, I don't think that'll pose too much of a problem.
Oh, that's excellent. We really appreciate that. Now, to my fellow directors, I know you've been monitoring some questions in the background or have questions yourselves. I'm nearly at the end of my questions with the gents, so we can throw it open to the members' Q&A. So in terms of communication and support policies, you mentioned the need for strata managers to get that role. We call it the strata role update, which we've done. Other than that, is it just a matter of waiting until we're activated to support you via health or yourselves, and then from there being as helpful as possible? Is that the key?
100%. You've hit the nail on the head. From your perspective, you are simply providing health with information. We hope that information is as up to date as possible, and then supporting them where they need support. And if, again, as I mentioned before, if it's a pizza night or a McDonald's night or whatever night it may be, you may think outside the box where your tenants are concerned and help them. But it's very much just a observation type role in terms of the management, and just listening to anything that it just aiding health in any way that you can if they need it. They were very good. No doubt that organisation is very much overwhelmed at the moment, but in terms of the experiences I've had with them, they've been very, very good.
Yeah. Oh, it's great to hear. And it's also good to arm our members with what they need to do and the preparedness, which we talk about. And we want to use this type of forum as a multiplier to reach out to, looking at 215 strata managers who collectively would manage probably 10,000 buildings across Sydney. So you've got that sort of that leverage and the reach into them.
Yeah. And that's key, Chris, just that preparedness, mate. Once we have those lists and hopefully down the track, those QR codes in place, that's all we essentially need, mate.
I mean, just on that before, Tony, I'm going to throw you for the first question, but just on that, Steve, the QR code, I mean, obviously we've asked for it to be mandatory. Do you see this as a lingering impact of COVID well beyond the current lockdown?
Look, I honestly can't see it going away. Vaccination is key, clearly, with all the communications going out in that space from the government. But as it stands, this isn't a short-term fix. So in terms of, I don't know, I certainly have an opinion, but it couldn't help. And it's not something that costs too much money to put in place, if anything, if you know what I mean. We still have to rely on people complying, of course, but it's become normal practice now. You see one of those squares, you almost point your phone at it as a
second nature. Yeah, of course.
Yeah, exactly right.
Yeah. And people are adept at it. I mean, if my parents have figured out how to do it now, then I think anyone could figure it out. So I think it has become second nature to people, and we do advocate for it in Strata. So we expect it to be the norm. It's not quite there. Obviously, masks are mandated in Strata. Sorry, Tony, I did promise to go to you. I'm going to get one more question out of the way. The mandatory masks, I mean, I know you're not at the local area command enforcement level, but do you get called to enforce people on Strata plans with not wearing a mask or anything like that?
We have a couple of compliance arms where that's concerned, and we rely, essentially we have compliance teams looking after people who are isolating, and compliance teams proactively essentially seeking people that aren't complying in terms of wearing masks. So, and they could pop up anywhere, sadly, for whoever isn't complying, I guess, but we have dedicated police, and we're talking large numbers. Yeah. So we have them across our whole region. I'm well aware that they basically dot the region in terms of east and west, and that is all their role is to just make sure that people are complying, whether it's curfew, mask or whatever. Because
often we're asked what role the manager has, or even owners corporations, which are the strata committee, so the volunteers, what role they have in enforcing the health order. And we're very clear to say that it's not their role, it's not the role of Mrs. Jones to be enforcing the health order on her neighbour. If she's got a concern, that's what the police force is for. And you've made that very clear that you're resourced to do that at the moment. Yep. And that's our recommendation, which I'm glad to hear you echo. Yeah, and look, let's be honest, we in those environments where you're living very close to each other, the last thing you need is to have, you're best off letting the police know. Let's just leave it at that. Don't worry, we'll get dragged. If Mrs. Mangles wants to drag us into a stay, our strata managers unfortunately get dragged in. We're happy for the boys in blue to deal with that. Now, I promised Tony that he's going to get to the Q&As, and Tony, it's time now. Can you throw to one of the Q&As, please?
Sure, Chris, and thanks very much. I think it's been great to get the police on to fill in some of that information gap that we've been wanting to have filled. Look, there's a couple of questions that have come in. One we've got posted prior, and also one that's come from Alicia, which is quite an interesting one, and I think pretty well everyone can see that question. But basically, it comes from, they can't be seen by all the.
No, I don't think our viewers could see that. So if you could just read, give an abridged version.
Whole lot of it, because I would encourage Alicia to reach out to one of us separately on this particular matter. But what it's saying is that she's got a particular owner in a building that wants to demand that the manager attend the building in person to have the AGM. And we also had a question prior to this from someone else saying, the best way to handle overseas committees who insist on face-to-face meetings. I'm going to throw to Brelly and also Emily on this, because we've all got slightly different businesses. But Brelly, I might kick off with you first, because your business is a little bit unique in your approach to this.
Yeah, sure. It's important to note with Alicia's question, she stresses that the person causing her grief is actually a strata manager, which I've got a very strong opinion about this. Going against your own really rubs against my grain. And strata managers who do it, I really don't get it. Like those who roll up to an owners corporation or a community association meeting on behalf of another strata manager and just cause the chairperson grief, I really don't understand it. But anyway, that's another question. For this specific case, Alicia, I'd be reaching out, if you can, to the principal of the business and just say, look, your employee is being completely unreasonable. If they happen to be the principal of the business, then you may be in a little bit of trouble. I'd also reach out to your committee themselves and just say, look, this person is basically trying to bully me into doing something which I'm not legally allowed to do. And I'd handle it that way, is the way I'd do it. As far as a practice tone and others on board about what we're going to be doing, come Freedom Day, as it's been described here, which I think is the 18th of October, we're still very much going to be under the mandate of holding Zoom meetings and holding meetings remotely, because there's no way that we can guarantee either the safety of our staff or attendees at those meetings. We don't have for lack of a better word, knowledge of who has been vaccinated and who hasn't. So that's going to be our approach initially to all of this.
No, good response to a little bit of a tricky question.
Yeah. It is, and Emily, your views on this, and I do want you to touch on the duty of care that you have as an employer of strata managers and placing them in front of owners corporations.
Yeah, so our view is quite similar to what Steve has said. For the moment, meetings need to be electronic, whether they're done via pre-vote, whether they're done in a forum similar to this. We certainly think that needs to continue. And most likely till at least the end of the year, until we work through this, how we approach who's vaccinated, who isn't, how many people can be in a certain size, what the square metre rules are, all of those things. Safety of our people and our clients have to come first. And as a result of that, we'll be sticking to electronic meetings until further notice. And I think most businesses will be doing the same thing. Alicia has added some more comments there to say that this is even more challenging than, Steve, what you were talking through, because it does involve the principle of the business. So I think there's probably some conversations to be had separately with us on that. But yes, it's meetings need to, certainly if there's areas of concern, that may even extend beyond Freedom Day. So electronic, Zoom, Teams, however you do it is the way to go for the moment.
Yeah, I suppose I'll add in my comments from my business, and I'm probably a little more representative of most of the members being, sort of a team of, about 12 people. So our approach is not to waste this crisis. So we've trained our owners corporations now to use Zoom or Teams to do their meetings. So it would be in exceptional circumstances that we would want to do an on-site AGM, because if you can imagine, you've got a 25-year-old female strata manager attending in someone's unit who they don't know personally, and there's other people in and around that, or they're in a car park at night. It just goes to the whole duty of care and sort of making sure you place them in a very safe workplace for them to do their job, and also how they get home and that sort of stuff. So we'll sort of take a position that if people want us to do in-person meetings, we'll have a pricing point on that, because that should be more valuable for us than doing just a Zoom meeting. we're finding that our attendances, our Zooms are higher anecdotally than if they were held in person, because people often don't want to have the conflict, or they've got kids to look after, or they've got other competing reasons. So coming back to the the pre-question about committees insisting on face-to-face, and also Alicia's specific questions about, almost being forced to have it. This is a business decision, but it's also probably a wider SCA New South Wales position to have of how we should be advising our managers to adopt this, not only in COVID now, but also further down the track. So Chris, that's the first big question that came through.
Tony, I'd say if we need to do anything as the regulator and fair trading to support that position, we'll count us in too, because what you're saying is the right approach, and if we can use our soft powers or hard powers to help get the right outcome, happy to do that as well.
Thanks, Matt. We'll certainly add it to the list of stuff that we want you to rally behind us on, starting with our cleaners. The question that I do want to throw to Chris and Stephen here, and thanks again for your time, is a couple of questions around, have you seen an increase in terms of the aggro or being called to site because of COVID, I suppose, altercations, because people are having different opinions on different things and whether they should wear masks or not?
Oh, Tony, I don't know if aggro is the right word. Certainly people get frustrated with people not complying with whilst everyone else is. So, and that's our function as a police officer, is to go and resolve those issues. In terms of an increase in that, not necessarily, mate. No.
That's good to hear, because I think, obviously any escalation there would be disappointing. So I think, Tony, that's decent feedback that people are behaving themselves.
For the most part, they are.
Yeah, at the moment. Can I just throw to a couple of questions that have come to before? And this stems around, it's sort of linkage to managers attending site, but the views from Chris and Emily and others on, can owners or can residents in a building demand that contractors be able to prove their vaccination status? And likewise, the other way around, should the contractors be able to demand to know that they're working, that they're going to be going into an environment that may be safe or not?
Tony.
Really? Oh, sorry, Stephen.
Tony, I've got an opinion on that. I think that's a discussion that should be had before you even have the contractor turn up to the location. If you're concerned about someone being vaccinated or not, maybe there should be some sort of proof of evidence of vaccination before you enter into any arrangement anyway.
Often it'll be like a fire contractor that might be going in and visiting 30 apartments. We don't know necessarily which apartments are. So it can get a bit complex there.
Apologies, mate.
No, you're fine. But I think when it's the day-to-day jobs where it's a booked in, I've got a leaking tap or I've got a leaking whatever, that sort of stuff, those sort of questions should be asked, in my opinion, by the contractor to say, these are our rules about coming to your site. Are you happy with those rules? Bradley, what are your thoughts?
Well, you think I know how to unmute my microphone by now, wouldn't you? Yeah, mate, I agree. We're taking very much a policy that to only use vaccinated. We're encouraging all of our contractors to be vaccinated before they go to site. I think that's going to become the post-COVID norm. In the once Freedom Day comes, I know I could go back to that. But it's something which I think our residents are going to be demanding. So.
Yeah, I mean, we've discussed this before. There's a commercial opportunity that's already emerged with businesses who have identified their staff, particularly those staff that come into contact with the public, as being vaccinated, who are already getting, obviously, work orders, particularly in areas where there might be vulnerable people. I expect there to be a lot more of this, Tony, as it plays out. But to Steve's point, I think there will be an expectation of us starting to ask for the vaccination status. There's a broader issue sort of emerging across society at the moment around how that plays out. But I think as responsible managers of trades where we're sending people out to potentially vulnerable communities, I think we'll find ourselves at a higher level of obligation to ensure that those people are going out fully vaccinated, as opposed to potentially putting them or others in harm's way. Emily, you agree? Oh, sorry, Stephen.
No, you're right, mate. I'll let Emily go, and then I'll just chime in with my 2 cents.
Yeah, I do agree. And I think we need to move away from requesting vaccination statuses as something that's confronting. It will become the norm. With the passports are becoming a thing that everyone's got on their phones or will have once they're vaccinated. So I don't think that we should shy away from that. And I certainly think that contractors and owners alike, or residents alike, will start to need to show those in all sorts of circumstances, not just with tradespeople.
Yeah, and the thing which I was just going to chime in on the end of that, Chris, was we have already started. I know a lot of strata managers are doing their own trade compliance, but if you're using the likes of a trades monitor or one of these type of firms, I would be encouraging them to start collecting this data on your behalf. So we've already started asking our trades for their vaccination status, plus their COVID safe practices when they go to site. So it's all about preparedness, and the more prepared you are, the better you can get things done.
Yeah.
Chris, and I think that might change too as the situation evolves. You know, particularly in the here and now, I think vaccination status is going to be really, really important. You know, and there's a stronger case for if you're not vaccinated, it's not been putting others at risk, because we haven't flushed through the availability of vaccines and making sure that every person who wants one can get one and is there. When we get through that phase, I think it could be a different discussion, because then it might open up into a voluntary choice, and so, you know, not be such a trigger point.
Yeah, I think you're right. At the moment, it's very topical, and it's probably going to be the point of discussion. Who knows what the future holds, particularly as we start to open up more generally, you know, across our communities. Steve and Christian, a question about QR codes and something that was topically raised in the media recently, which is what access does the police have to information in those QR codes, and are they going to be used solely for health?
Police have zero access. They are solely for health. So it's all about close contact, the tracing. So we don't have any access from a police perspective to any of those people's information at all.
Yeah, I think that's very reinforcing. Last week we had a doctor and also the chief executive of Western Sydney Health, and the chief executive said that he didn't have access to that QR data, only the doctors did. So it's really refreshing to hear that, but also as we're trying to normalise it and put it out to every strata plan, I think comforting to know that that information is going to be held in the right hands. Emily, you've got a question to pose.
I do. So Marina's asked a question, and this one's for Christian and Stephen. So in relation to deliveries and waste, and I think this is probably going to be quite a common thing that lots of strata managers are dealing with. So she says, in relation to deliveries and waste, is there only one unit? If there's only one COVID plus unit, so one positive case, would help still be provided? Or I guess if I can add to that then, is that something that the owners corporation or local committee need to work towards and facilitate?
Emily, that would be a case by case, and it'd be something that would have to be resolved within that strata. Health certainly haven't got the resources, and I don't think that we could get a contractor going from unit or apartment block to apartment block, servicing one or two or three individual apartments at a time. So that's something for your group to discuss and come to some sort of arrangement in.
And that's a good point, Steve. We do have and have put out some guides for our members to actually be prepared in the event that COVID, they do have a positive case or a cluster within their apartments. And part of that is, and I guess to Marina's question, part of that is actually working out what your plans are in the event that that does happen, and how you as an owners corporation, because everyone will be different, how you guys actually manage the waste, manage the deliveries, all of those things that you can't do. Well, it's going to be, I guess, different from site to site, depending on the size, depending on the location of a lot that's infected, all of those things.
The only thing I could suggest, Emily, that we can manage, I guess, is to just double bag any waste that comes from a residence that's been infected.
Yep.
Or even, you know, a close contact if you want to go that far, but certainly if they're COVID plus.
Perfect, thank you.
Yeah, some common sense advice. Thanks, gents. Stephen, you've got some questions.
I do. There's one that's come here from Anthony, which is one which I'm going to answer because I've got a direct experience with it, but then I wouldn't mind getting Christian and Stephen's viewpoint. So Anthony has a building where he has a COVID positive case on a ground floor apartment, which abuts a entryway. And he says what the issue is that other residents in the building get quite agitated when this person, COVID positive person, goes out into their courtyard and smokes. and they think it's a little bit too close to the common entryway. We had this experience in a building, and basically that resident was directed by New South Wales Health on what they could and couldn't do. And the approach was, look, as long as you're not encroaching too close to the entryway, that's okay. But I'd just like to get your opinion on that.
Stephen, this person shouldn't be leaving their unit block, and I appreciate where apartments are concerned that we don't want people smoking inside, and that was one of the major issues that we had in the general lockdown, is that we have people that smoke and they simply can't during that 14-day period. There's no provision for people to just come outside and have a 5-minute cigarette break.
Yep.
So
there you go.
That would be a case where they're not complying with the order, and the police should be contacted.
Yep.
Yeah. Some very sage advice. Thank you.
Yep.
Tony, you got the next one.
Yeah, thanks. And it's one that's come through from a different Anthony. And it's something we're going to cover next Thursday. So I just want to give a bit of a shout out to all our licensees in charge, and, I suppose the senior managers. We're doing a webinar where we're going to talk about business related issues around COVID and dealing with your staff and that sort of stuff. So Anthony, if I can put you off and get you to come along next week, I think that's probably a question that a lot of people would like to have an answer to, which is, can a licensee or can a manager or a owner of business demand that their staff are vaccinated? So that's not a Strata related question. It's actually a whole of every employee in New South Wales question, I think. So we might tackle that next week. But I do want to tackle some other stuff. These QR codes and open space. Rick has come through, is asking, is it a requirement to have a QR code around a barbecue or an open area? My personal view is your QR codes is about internal or enclosed spaces. I think they're pretty useless around a tennis court or a barbecue. But secondly, in terms of those open air recreation facilities, if they are within a community association or within a strata, the direction that we've had from Kerry Chant is that they should be closed down. And you just need to do that in a safe way, which Emily and I talked about last week. Like, if you're going to close down an outdoor pool, just make sure that you're not going to trap people within it, and just be careful how you do it, but at least get some advice on it. So Rick, hopefully that answers your questions. Brelly, you deal a lot with building managers. A question there about should a building manager be, they say compensation, but should they not be charging if they're not able to attend?
Oh, that's a difficult one. Most building manager contracts are with the actual company. So as long as the building manager is able to provide alternative employees to actually service that site, I don't see any issue with it. I'm not quite sure what Chris and Emily have an opinion on that one.
Yeah, look, I do have an opinion, and the opinion is that sometimes services can be provided remotely. We have remote Strata software, but there's a whole bunch of coordination that can be done, not necessarily on site, but that can support those buildings from a building management perspective. So I think the context of this being a relatively short period of lockdown or potentially affected LGAs restricting some of those employees to go, I think as long as the business has other resources to support that community, whether it be on site or remotely, I think that can be done. And I guess it raises a broader sort of evolution of the way we view on-site building managers, and perhaps we look for service-based contracts as opposed to hours-based contracts. And I think you'll start to see that moving forward, particularly as businesses evolve their offshoring and their software-based service delivery. But that's my view on building management. Steve, Emily?
I agree. Most companies have been able to work around what's going on or come up with alternatives, particularly if they're in areas of concern. So no, I unless there's an extreme circumstance here, I don't think compensation is something that we look towards.
No, because often in the background there's a lot of work that's been done
Absolutely.
over and above to manage these situations, which need to be factored in. Matt, there's a Dorothy Dix here for you that specifically calls out your name. Do you want to read that one out?
Yeah, this is from Andrew. So would we be in a position to support strata managers to request vaccination information from tradespeople because having struggles there? I'd say yes, definitely. Happy to put a conversation with HA and others, MBA, so that they're clear, because I think they've even started a campaign with construction site personnel where you put a sticker on your hat with a V to say vaccinated. So there's definite support for sharing information so we can talk to them. And the next one was about thoughts on strata managers being able to request vaccination information from owners and occupants. As in, if trades say, well, I'm not going in unless you can prove to me that you're vaccinated. I think that will kind of be the discussion in the short term, actually, that if you're saying, prove to me that you're vaccinated, come in, well, I've got to prove back that I'm vaccinated, most definitely.
Yeah, there'll be an expectation, as you said, potentially in the short term. Matt, just to clarify, when you said you were referring to we as the regulator there.
Oh, sorry, me. Yeah,
sorry, I just wanted to give we can see the question, but you as the regulator being able to start to put that pressure on, as we're starting to see across the industry. We've got 5 minutes left, gents, so we're just going to wrap up these final questions. Emily, you've got one here.
There's one from Paul, again for Christian and Steve, and relating to masks. And there was a follow-up that's been moved into the other section, but it talks about, I have people in an 8-story building that continually will not wear a mask even in the lift, and they actually have lift footage. So there's cameras in the lift, and so that's how they can actually determine that this is the case. And to give a bit of context, we've had quite a few questions around how do we police people in common areas not wearing masks. So that's been a fairly common scenario we've had questions around. So your thoughts on that?
Emily, it's sad that people just won't comply, really, especially in those like density housing situations, unfortunately. But look, that again, it's something that I would bring to the attention of the local police, especially if you've got that.
If you've got the footage, I think is key here.
Exactly right. Yeah. So if people want to put themselves at risk of a $500 or $1,000 fine, well, so be it.
Yep. Perfect. Thank you.
Well, ladies and gents, it looks like we've exhausted all of our questions, which I think is exceptional. We've got through quite a few. Christian and Steve, is there anything that you want to throw to us? I mean, I know you've given us some absolute gems of your wisdom, but also really practical tips in how the strata management industry can support you. Any last thoughts or comments for our members?
Chris, no, firstly, just thank you for your time. We really appreciate that you are all being very proactive in the space. And that certainly helps us all as a community. And just going back to what Tony said, just a little bit of information. I don't know if this helps Tony, but as of the 30th of September, all police have to be vaccinated. And any policeman that chooses, or any police person that chooses not to be vaccinated, will take annual leave until that is exhausted, and then will not be getting paid until they choose to come back vaccinated. So there's a snippet of information which you can, food for thought.
Yeah, we'll use that for our webinar next week with licensees in charge, Tony. But that's incredible. Steve and Christian, can I just thank you? And I know not just for your attendance today and to assist our members, but also for the job you're doing, which is incredibly important and supporting many vulnerable communities, particularly in your area of Blacktown, which I'm sure you're greatly appreciated out there. But if you don't hear it enough, thank you sincerely on behalf of all of our members. And we really appreciate your time in coming on today.
Thank you all.
Thank you all. Thank you.
To our members, thank you very much. We have one quick update before we do log off. The authorised workers confirmation back to government. We've received 83 survey responses, which reinforce overwhelmingly the challenges that have been experienced by buildings having those lockdown area restrictions impacting cleaners and building managers. Thank you in advance for that information. We're going to use that as part of a response back to government. As always, we appreciate your attendance. We hope you're well out there. Keep safe, and we'll see you next week. To Matthew, to Tony, to Emily, to Steve, once again, thank you.